Hello everyone. Today I am here with another video that is on the topic of a basic anatomy, that is bone. I hope you all have gone through my previous videos of cartilage in which I discussed the basic features, the types, the distribution as well as the histological aspect of cartilage. So if you have not gone through them, please go through them. They are really interesting videos and I have made my best to make them very simple so that you can understand them and also write them in your exams. So now talking today about the bone. As we know that bone and the cartilage are the two types of the sclerous connective tissue, right? But the cartilage is not very hard and rigid like a bone. It is firm enough but not very hard and rigid. But bone, which is forming the skeletal framework of the most of the body, is very hard and rigid. It is the bone to which all your muscles they are attaching through the various tendons and the ligaments. It is the bones which are articulating with each other to form the joints also. So now, bone, as we all know, a connective tissue has a matrix in which there are embedded fibers and the cells, right? So similarly, bone has a matrix like the cartilage, but the difference is the matrix, no doubt, it is made up of proteoglycans and many other salts. It has the inorganic component that is made up of calcium and magnesium salts, and which is basically making it hard. And then the organic component is made up of majority of the collagen fibers. Like the cartilage is covered by perichondrium, the bone is covered by periosteum. Like the cartilage cells are known as the chondroblast, chondrocytes. The term used for the bone is osteo. We use osteogenic cells, we use osteoblast, osteocytes. So osteogenic cells are the cells which have the potential to form osteoblast. Osteoblasts are the cells which can divide and lay down the bone tissue, and once the osteoblast, they become mature enough that they lose the power to divide mitotically and form more of the tissue, then they get embedded in the matrix itself and they are known as osteocytes. So it is pretty similar to the cartilage, only the nomenclature is different. For the cartilage we were using the terms chondro, for the bones we are using the terms osteo. Okay, so now coming to the structure, the basic structure of the bone. If we draw a simple diagram of the bone, this is a long bone, right? This is a long bone, the humerus that is present in your arm. So this bone is forming a joint here with the glenoid cavity of the scapula to form the shoulder joint, right? Now this part of the bone, you call it as epiphysis, and this is the shaft of the bone, you call it as diaphysis. Simple, epiphysis, diaphysis. Okay, now this part of the bone is made up of a compact bone. We'll be doing with the histological structure of compact bone, cancellous bone in another video. Here you should know that most of the diaphysis part is made up of compact bone, and there runs a marrow cavity, a long marrow cavity in the center. Whereas in case of the epiphysis, at the ends of the long bones, there are many marrow spaces. There are many marrow spaces. So these are the marrow spaces. And what is this bone? In a cancellous bone, also known as the spongy bone. Now, this entire bone, as we did cartilage, is covered by the perichondrium. The bone is covered by the periosteum. So obviously periosteum will be covering this outer surface of the bone. Now periosteum, like the cartilage, has a similar structure. That means it will have an outer fibrous layer right? And the inner cellular layer. Now, what is this inner cellular layer made up of? This inner cellular layer has osteogenic cells. That means they can form the bony tissue when required. They can change into osteoblast and they can form the bony tissue, right? So the periosteum is the covering membrane. So you can also call it as periosteum is the limiting membrane of the bone. Now, why do we call it as that periosteum is the limiting membrane? This is because if the periosteum is damaged, right? If it is torn off, if it is damaged, obviously these osteogenic cells are exposed out and then they can form the bony tissue wherever they will extend out. I think I am clear enough. This periosteum is forming the limiting membrane. You can get a question, why is it known as a limiting membrane? Because the inner layer that is made up of the osteogenic cells, these cells, they have the potential to form bone. Now, if the periosteum is stripped off, then these cells, they can form the bony tissue wherever they extend to. That is the basic reason why with growing age, in the old age, when osteoarthritis is affecting the bones and the joints, the bony ends, they have projections. The bony ends will have projections. Those projections are known as irregular projections, are called osteophytes. So I think the reason is very clear, because if the periosteum is damaged, these inner osteogenic cells, they will extend out and they can form irregular bony tissue that is known as osteophytes. Now, this was about the periosteum. Periosteum is present all around the bone except at the articular surface. This point is very important. There is no periosteum here. And if you have gone through my previous video, I told you these ends are covered with the articular cartilage where perichondrium is also absent. So that means there is no covering around the cartilage. There is no covering around the bone. So that means in this part, there is no periosteum, no perichondrium, whereas periosteum is surrounding the rest of the bone. Okay, then we come to another layer, that is the endosteum. Now, what is the endosteum? You have a marrow cavity here. So, this marrow cavity is surrounded by a layer that is known as the endosteum. So, you have another layer here. This layer is called the endosteum. Similarly, you will have this layer all around these marrow spaces. These are called the endosteum. Endosteum again has osteogenic cells. It again has osteogenic cells. That means they have the osteogenic potential. They can again lay down the bony tissue. Now, this periosteum layer that is present around the bone is very vascular. It is very vascular and it has also a good nerve supply. Now, if you compare it to cartilage, cartilage was completely avascular and non-nervous tissue, whereas bone is very vascular and has a good nerve supply. This is because the periosteum has a good blood supply and a nerve supply. That means it is sensitive to pain, sensations. Another important feature is all the muscles are going to take origin from the bone or they are going to insert on the bone. So when they are originating or inserting onto the bone, they are getting attached to the bone via the tendons or the ligaments. So these tendons and ligaments, they are coming and attaching themselves onto the periosteum. Right? They attach themselves onto the periosteum. Another important thing is that these extend into the outer part of the cortex. See, this is the bone, compact bone. This is the marrow cavity. The outer part is known as cortex, and then you have the medulla. So, the ligaments and the tendons, they extend into the outer part of the cortex of the bone, piercing the periosteum. They pierce the periosteum and enter into the cortex of the bone, and these fibers are known as the Sharpey's fibers. This is a important MCQ question, that the various tendons, the ligaments, they are attached onto the bone and they reach the outer cortex of the bone through the Sharpey's fibers. Okay, so this is all in general about the bone. A vascular tissue, periosteum is vascular, has a good nerve supply, is sensitive to pain. All the structures are attached to the periosteum. Those which penetrate deeper, they are through the Sharpey's fibers. This is the epiphysis, diaphysis. This will be the growing end of the bone. If the bone has still to grow, this here is the growing end of the bone, and here is the epiphyseal plate of cartilage present. Epiphyseal plate of cartilage present where the bone occurs, where the growth occurs. So this is all about the basic features. If you understand the topic, kindly like the video and subscribe my channel. If you have any doubts, you can write it down in the comment section. I'll try my best to solve them out. Thank you so much.